Our next talk is by Adrienne Crowder, and she will be presenting on youth opioid use in Guelph and Wellington County. So Adrienne.
Okay, Mia.
Hello.
So I'm good to go.
Yes, you are. Go ahead.
Okay. Hello, everybody. My name is Adrienne Crowder, and I work as the manager of the Wellington Guelph Drug Strategy. So really appreciate this opportunity to share our research into youth opioid use in our community, which we conducted in 2020. The community of Guelph, Wellington, City of Guelph, County of Wellington are in southwestern Ontario. We have a combined population of about 230,000 people. 60% of that population is urban and about 40% is rural. So when we learned that 18% of youth in Guelph, Wellington in grades 7 and 10, that's grades 7 and 10, reported using an opioid within the last year, we were very concerned and we wanted to know more. Those stats came from our local public health, who had conducted a youth survey in 2018. We wanted to understand what kinds of opioids our youth were using. We wanted to know how youth were using those opioids, and we wanted to know what was driving youth opioid use. So we needed to talk with a whole variety of youth to make sure we got the language correct and the process correct. We knew we were asking about a sensitive and an illegal activity. So with the feedback from youth, we created a survey, and we launched that survey on Instagram in May of 2020. 53 youth who met our survey criteria responded. 74% lived in the city of Guelph, 57% were female, 55% lived at home, and 59% attended school all of the time or part of the time. 84% of our respondents told us they were using prescription opioids, primarily Tylenol 3, codeine, and Percocet. And use of prescription opioids was highly correlated with being in school some of the time or all of the time. 16% of our respondents were using opioids from the unregulated market, primarily fentanyl, and there was a correlation between fentanyl use and the first use of opioids under the age of 14 years of age. 55% of our respondents were consuming opioids orally, 14% were sniffing, 14% were snorting, and 11% told us they were injecting the opioids that they were using. 44% were combining opioid use with other substances, alcohol, cannabis, and benzos being the primary substances. And of course, concern around someone having double depressant drugs in their system and that increasing the likelihood of overdose. 72% were consuming at home, either with their own home or friends. We don't know if they were consuming with other family members or with parents present. That would require some further investigation. 68% were using with a friend or partner, and 32% were using by themselves, again, of great concern given the risk of overdose. 11% of our respondents had not heard of naloxone and did not know what it was used for. The most frequently provided reasons for using opioids were to relieve emotional and physical pain, which really ties in with the data that comes from youth using substances to self-medicate against trauma and against toxic stress. There was a wide distribution how often youth used. The column on the left, 30% used every now and then, once or twice. The fourth column in, we had 17% of our respondents telling us they were using daily or almost daily. 87% of our respondents told us it's easy or somewhat easy to obtain opioids. 56% have purchased their own supply, and 22% reported first use under the age of 14. The youngest had first use under the age of 10. Youth had very realistic concerns about their opioid use. They were worried about addiction, overdose, trouble with the law, broken relationships with family, and difficulties at school or dropping out of school. What did we do with the results? We created an infographic, which apparently is not coming up on this slide, and we sent that infographic throughout the drug strategy. We uploaded it on CAMH's Evidence Exchange Network, and we released it to local media, which resulted in some local coverage. We also, I'm not sure we've moved to another slide yet, but we also held a forum for local youth service providers in October 2020. And what do we want to see happen? We want to see harm reduction services for youth in our community. We'd like to see increased resiliency programming, youth involved in service design, and we'd like to have appropriate information on opioids for youth in grades 5, and 6. I'm worried they will die before they ever get the chance to live was one of the quotes that we got from our respondents. That's a concern also for the drug strategy, and we will continue to work to reduce the harms associated with youth substance use. Thank you for the opportunity to share our work.
Thank you so much. A very important presentation. If you haven't submitted your questions, please go ahead and do so. I will start off with a few questions of my own. I guess the first question I have is for youth specifically. You mentioned a lot of them were completely unaware of naloxone, or that maybe using alone was a risk factor for increased overdose. I was wondering, through your experience, what do you think could be a good way to reach these youth with such information and make sure they are aware?
Well, one of our recommendations was to really try and improve the kind of information youth receive in schools, and they would need it in grades 4, 5, and 6. And I'm not an educator or child psychologist, so I'm not exactly sure how that information needs to be framed so that it would be appropriate for youth that age, but somehow in a non-scary, non-traumatizing way to share with youth some of the information around probably why people will turn to substances, alternative ways to self-soothe and to self-regulate, and also some of the risks involved. I mean, I think that there's a real opportunity for us to do a much better job with youth in elementary school to help them be appropriately and age appropriately prepared.
Okay, thank you so much. So a few questions have come in. So I guess the first question is about access. So someone has asked, with apps like Lifeguard for those who use alone, how do you address unequal access? The fact that a majority of drug users do not have access to reliable internet or cells, what are alternatives for others who use alone?
Yeah, that's a really good question around the risks associated with use alone. And again, in our rural areas, there's often very sporadic internet. It's not always consistent, and you know, youth ability to be able to reach out to get support in an emergency or to have the kind of contact with harm reduction services will be really limited. I know schools have done a lot to try and get different types of electronic tablets or computers out to all their students because of the pandemic. So maybe one of the pluses of the pandemic is that there will be more opportunity for youth to have that kind of access.
Okay, thank you. Another question is, what is the correlation to class status and racialization?
Really good questions. Sadly, we didn't get that in our research. That'll be research round 2. We came up with all sorts of questions we didn't ask. We didn't ask youth, had they overdosed? You know, after the fact, you see all sorts of things. We're a small community drug strategy. We're not a research organization. We worked with an ethics group at the University of Waterloo to make sure we got our questionnaire that was validated and reliable, but there's definitely a lot of opportunity to ask those very important questions.
Okay, great. Another question is, do we know if there are recent national youth statistics regarding opioids?
You know, that's a really good question. We only at a very broad level. So there is Ontario-wide information. One of the reasons we were so concerned was the prevalence and incidence of opioid use in Ontario for grades 7 and 10 was actually 9%, and we were at 18%. So we would double the provincial average. One of the reasons we were really concerned. It's very high level and it's not very nuanced. So I think if anybody's looking for a research opportunity, that's a really good one.
Awesome. And so I guess another question that I had was, based on your experience for like reaching out to youth specifically, who do you believe are the key stakeholders and policymakers that should become aware of the research results immediately?
Well, I think we have to really involve youth in that process. I mean, obviously the policymakers are not youth typically, but we're asking about very sensitive, stigmatized, and illegal activities. So we really need, in order to find out information, we need to make it a very safe process for our youth to be able to talk to us. So however, really starting the whole kind of spirit of this type of conference to move into a much more open discussion as a society around youth and substance use, and to take it out of the out of the sort of put it into mainstream conversation and to be able to inform policymakers with accurate information, so it's not a hidden subject that people don't want to talk about. I think we got a lot of work to do, and really appreciate opportunities like this conference to help us do that.
Great, thank you so much.